So I am actually just so excited for this evening. I have Dr. Claire Ashley joining me. Now, if anyone here does not know who she is, she's fantastic. Go look her up on Instagram, follow her page, look at her posts. She's just brilliant. I got to know her via aesthetics, essentially, but she has this wonderful portfolio career. She encompasses so many different things into her clinical practice. So she currently works as a GP. She also, as I mentioned before, is an aesthetics doctor. And then she has done some really brilliant work sort of talking about burnout, talking about stress. These are all things that have been very important with COVID and everything else that's been happening with the pandemic, but also just in general. And she's done some really beautiful, honest posts and shared her experiences about burnout for herself in her own career. And I'm just excited to be able to speak to her. So we'll just give her a second here to join. Hi, it's nice to see everyone. I hope everyone's well tonight. So we've got a few different things that we want to talk about this evening. First of all, obviously, is the portfolio career. And I was actually having a conversation with her on the phone a few weeks ago, and we were talking about portfolio careers and how a lot of medics, and I think young medics and young doctors, don't realize that this is an option for them. And it's one of the things that, you know, as you're sort of in the rat race and progressing through medical school and your foundation training, it always feels like there's a very set training pathway there that you have to take. And sometimes it feels very narrow and like there aren't other things that you can do and incorporate into your practice. And what we really wanted to emphasize, and I think what she does really beautifully, is, you know, there's so many different things. Field of medicine. I think I've got her here now, so we'll just give it a second and see if I can get her. Oh, there we go.
Hi.
Hello, how are you?
I'm
good.
Good.
It's so good to see you.
Right, I'm just turning you up. There we go. We're all sorted. Yeah, it's great to see you.
It's so nice to see you. How has your day been? Have you been loving the sun?
Yeah, do you know what? Actually, I have. So my working week this week doesn't start until Thursday. So I went for a lovely walk. I've been playing in the garden with the kids. It's been a really nice day, actually. Thank you. What about you?
I've had a really nice day as well. I did a little bit of work today, but actually I just had a really nice walk out in the sun. And like, so I went to a park and just sat and enjoyed what feels like summer possibly starting.
Yeah. Well, I'm just trying to adjust my lighting. Is that okay? That's okay, isn't it?
Yeah.
Okay.
So I was doing, I was trying to introduce you a bit, but I wondered if you would be happy to introduce yourself and just give people a little sense of everything that you've done.
Yeah, of course. So my name's Claire. I'm a portfolio career GP. I originally trained in anaesthetics after I did my F1 and F2 years. Did that for 3 years and then decided that I wasn't too keen on doing that anymore, left to do GP training. I qualified as a GP in 2018 and then went straight into a salaried post. Burnt out pretty quickly within about 6 months of starting that post. And since then, over sort of the past couple of years, I've had to kind of change my working practices and change how change my outlook really on my career in order to be able to work kind of sustainably. So at the moment I work as an out of hours NHS GP. I do some work as a private GP. I have my own aesthetics business, although obviously at the moment we're not working, unfortunately. I do a little bit of coaching and mentoring. And I've just left a salary job, in fact. So, my job kind of changes quite frequently, depending on what my current needs are and how I'm feeling about things. So yeah, that's a brief introduction to me.
And there's so much in there already. So I kind of wanted to jump right in and just start talking about burnout, because I've said this to you quite a few times, but I think you articulate those experiences so beautifully. And I think it just really resonates with a lot of other healthcare professionals, or even, you know, people not necessarily even doctors, nurses, but people in other fields who have stressful jobs. And I just wondered if you could tell us a bit about your experiences of burning out, what that actually looks like, and what it means when you say that you've burnt out.
Yeah. So, I mean, I don't know about you, but in my training, the word burnout was never discussed. It was never talked about. We were never given the skills to recognize it or to manage it either in our jobs. And for me, what it looked like was I sailed through my training. I did really well. I loved my training. I loved medical school, and I felt fine. Then, as I qualified as a GP, I went into a job that was really high pressure and was busy, like really busy, so much busier than any job I'd ever done. And I know that I'm not kind of oversensitive to this, because at the time my surgery was using a piece of software called Ask My GP, which quite a lot of GP surgeries now use. And what it does is it collects a lot of data. So you use the software to manage all of your patient requests. So it collects the data as to how many patients are requesting appointments. All the patients go through that. And out of every surgery in the country that was using this particular piece of software, we were the outlier in terms of patient demand. So we were off the chart, like physically. I've seen the graphs, we were physically off the chart. So I was working in extremely high pressured surgery with the most demanding patients in the entire country. And by demanding, I mean in terms of the numbers of appointments requested. And I was expected to see 50 plus patients a day. I wasn't given any time to do my admin. I'm very much a coper. So I kind of, because I was newly qualified and I seemed to be getting on all right, I think they just left me to get on with it. And I didn't realise what I was kind of slipping into. So I started to struggle with making decisions at work. I started to become very stressed. I stopped sleeping. I started having nightmares. I stopped looking after myself. So I'm very much into exercise, and I normally, like, I do some movement every day, and I'd normally work out like 3 or 4 times a week. I kind of stopped doing that. For me, that's crucial to my stress management. And that kind of gradually slipped away. I started eating all the wrong things. I just became very irritable, really grumpy, really pessimistic, not a very good mum, not a very good wife. I was doing all right at work because the partners were saying I was doing okay, but I was working like 12-hour days, and I just became unhappier, more and more unhappy. And then I had a few things happen in my personal life, and a few kind of, I felt like I was coping all right. And then a few other things happened, and it literally just pushed me over the edge. And the moment that I realized that I had a problem was I had a panic attack on the phone to my husband. And I've never had a panic attack in my life. And at that point, he was like, this has gone too far. And that was the moment when I realized as well, I'm massively in this. So I felt constantly worried, irritable, snappy, extremely, like, very low in mood, very unmotivated. But I was still getting up and going to work. Couldn't switch off in the evenings, wasn't looking after myself. So, and I'd got with burnout as well, the minute that you tip into not caring about what's happening and being emotionally detached from what's happening, that's where burnout occurs. Prior to that, it's kind of really bad stress and perhaps some anxiety and depression. But the minute you tip into that, that's when you know that you've gone too far. So that's what it looked and felt like for me.
I mean, that sounds very familiar to me. And that thing you said about there wasn't really a term for it. I didn't even qualify that long ago. Now it's very topical. It's talked about a lot, not necessarily actually dealt with in a meaningful way by a lot of hospitals and organizations, but at least there's that conversation around burnout. But yeah, it certainly wasn't anything I'd ever heard of when I first started working. And everything you're saying, like, I gradually, again, it's like that slippery slope where you almost become more and more apathetic, and you don't look after yourself. You care less and less. You feel detached, but then at the same time, there's this undercurrent of just anxiety that sort of runs through everything. And that not being able to sleep very well. Or I was at a stage when, I was working in a really stressful situation, like very understaffed, very undersupported. I pretty much went to the hospital, came home, and I got into bed, even if it wasn't necessarily bed. It was like, get into bed and then stay in bed until it's time to go up. And I think on the surface, I would go into work and I looked fine and I was getting everything done. And I think I was efficient and everything seemed okay, but actually I just like completely burned out. I just couldn't, like, it wasn't sustainable. I couldn't keep going like that.
You know what, you sharing that just rings so many bells with me. And the one about you going to bed when you got home, that's what I wanted to do as well. I mean, I couldn't because I've got children and they physically keep me up, but I didn't want anything to do with them when I got home. I couldn't physically cope with more people needing me, because I barely had enough to look after myself, let alone other people. And that really resonates with me as well, Emmaline. And you're right, you know, I mean, I don't know what your experience was when you went to the hospital and you said, I'm really struggling. When I raised concerns, when I said, this has gone too far, it wasn't necessarily met with kindness or compassion. The partners did allow me to reduce the amount of patients that I was seeing in order for me to continue to work, because I think I'd got to the point where I would have had to have gone off sick had I continued. And they wanted me at work. And actually, I wanted to prove to myself that I could get better whilst continuing to work. For some reason, that was really important to me. Perhaps not the best decision looking back. I think it probably prolonged my recovery. But, you know, once I'd asked for help, they reduced my patients down, but then they didn't really, no one asked me after that how I was doing.
No.
So it was not a particularly, my recovery wasn't supported by my surgery. I looked at other things, other people to help me through that.
And I think that's the thing, a lot of time that support isn't really there, you know, whether it's the surgery or the hospital, or you don't feel like it's there. I mean, to be fair, I never articulated like, I'm burning out, I'm struggling. But what I did do is, you know how they've given junior doctors the power to exception report, you know, if they're staying late or if they think there are dangerous conditions on the ward.
Yeah.
And so I was doing that, just documenting like, look, you know, I'm staying 2 or 3 hours late every single day because of short staffing. I feel like there is a patient safety issue as well because of how short staffed it is and how junior the staff is. You know, we don't have a consultant most days. Our reg is constantly pulled away to cover nights or other things. I think this might be a patient safety issue. So that was flagged up immediately. But then the meeting that I had afterwards, where I was called in with a few consultants and a few of the hospital admin, it was more like, well, I don't really think there's a patient safety issue. I think you're just very junior and inexperienced, and it's a stressful situation. You know, that was what it was more around. And at that point, I kind of gave up, and I was like, you know what, I'm just going to get through this job and then move on to the next one.
Yeah. And that, I think your experience there, which frankly is disgraceful, is not untypical of what happens when we raise these concerns, unfortunately. Because what happened to you there was they turned around and said, well, actually, we think the problem is you, not the pressure that you're being put under, not the chronic under-resourcing, not the chronic lack of staff or senior support. You're the problem. And we both know that that's complete rubbish. You know, you were put in a situation where you weren't able to work safely. You escalated your concerns appropriately and they didn't take it seriously. Yeah. That is just such a really typical experience of what happens when really good doctors raise concerns. They're just not taken seriously. And it's really sad. And actually, so it's slightly different when you're in a GP surgery. So I just went to my practice manager and said, I'm struggling. I didn't use the word burnout because I don't think I even realised that that's where I was at that point. I just knew that something had to change. And like you, I had some very unsupportive comments made back to me, which was what sealed the, you know, ultimately leaving that job, because I didn't feel that they cared. Yeah.
No, it is a shame that that's the, you know, the response that, again, like you said, is completely typical. And I think you did a great sort of survey amongst, I think, other healthcare professionals recently, where you're asking them what is an example of good support and what's an example of bad support. And luckily there were, you know, a lot of things that were brought up that were like, actually, this is really good support. And it was all stuff that was so simple, like, let us drink water while we're on shift, you know, give us a place to rest if we're working 13 hours overnight, you know, don't charge us for parking if we're taking our car to our jobs. Like, those simple things which have a massive boost on staff morale. And then those silly like token gestures that are thrown out, like, oh, have a t-shirt that says thank you. Or, you know, sometimes it can be very patronizing when they're saying, oh, you need to learn how to be more resilient, so here's a yoga class which you would never be able to do anyway because you're working, you know. And they're not very helpful solutions.
Mm.
But I
Yeah.
love that survey that you did and all the answers you were getting.
Yeah, I mean, I think what that shows is that trusts and surgeries are not providing just basic working rights at work and what you're legally entitled to, let alone the additional stuff that we need, particularly after the year that we've had with COVID. You know, we've got a workforce that is effectively traumatized, I would say, particularly people who work in hospital, you know, overwhelmed, overworked, everyone's exhausted. And we really need to have some additional mental health support from the trust, and also I think externally as well. But they're not even getting the basics right. You know,
No.
some doctors were saying they can't even have access to water during their shifts. People who are getting parking fines, you know, if they're staying late in A&E to help with trauma, someone messaged me about that. And just things where you think, goodness, these are the basic things, and they can't even get that right.
Yeah.
And that's quite depressing, really.
It is. It is very frustrating.
Mm.
And the other thing I want to talk about is what your experiences have been like working during COVID as a GP, because it's really changed the way that GPs have had to practice.
Yeah.
You know, that you've had to do all these virtual consultations, which honestly are not your choice or what you want.
Mm-hmm.
And I think, you know, again, it's such a shame, but there's been so much bad media coverage out there about GPs, or I've, you know, heard comments like, oh, GPs aren't working, which is not true at all. It's categorically untrue. But what has it been like for you working during the pandemic?
Yeah, so I left my salary job at the end of January. Hang on, let me get this right. Last year. So January 2020. And then my plan was to do out of hours until locum for a bit and just kind of find my feet and protect myself kind of mentally from potentially burning out again. And then the pandemic hit in March, and the out of hours immediately became fully booked. Like, you couldn't get shifts. Normally they're calling you, begging you for shifts because they can't get people to cover it, because locum work dried up overnight, because all the GP surgeries stopped seeing patients face to face on the advice of NHS England. That's why they did that. They shut their doors for patient safety. Now, that doesn't mean that we weren't still seeing people face to face. It just meant that everyone had to be triaged or consulted by telephone or video first. And then if it was clinically necessary, people were being brought in. Now, for me, on a personal level, that was bad on two fronts. So first of all, I don't like telephone and video consulting, but I'll come to that in a sec. But also for me, work just literally dried up overnight. So that was a bit of a stress. Not just the fact that the pandemic was happening, but for me personally. So what I had to do then was I had to react to that. So I took a private job, which was consulting from home. The timing just worked out beautifully because they just ask that you get to a certain number of hours. You have like an annualized contract, and then you're free to pick and choose your shifts as and when it works for you. It's working from home. So that was brilliant. That just came at exactly the right time for me, because then I was guaranteed a salary. And then I just did loads of out of hours. I just took every shift I could get and booked them in. So for me, I went from having pre-booked, like from physically being in a surgery and dealing with patients face to face every single day, to either working from home and seeing them remotely, but potentially signposting people to see their GP face to face, or being in the out of hours setting, so working weekends and evenings, where also they were very keen to not see people face to face. So again, that was largely telephone and video consultations, and only seeing people face to face if necessary. My favourite shift pre-pandemic in out of hours was visiting. So that's when you go and visit people in their homes. So generally very old, very frail people who are housebound. You get a driver, you get a car, they drive you around, like, yeah, and you have like banter with the driver. They're there to back you up if there's a problem. You know, they're there for safety. They carry all the drugs. You go in and see patients in their home. You come out. You drive off. You like type up your notes. It's a lovely shift, but that stopped overnight because we just weren't visiting people. So, kind of the work as I knew it changed overnight. And I would say there was a dip initially in patient demand because people didn't think that their surgeries were open, but then it did gradually start to come back up. On the advice of NHS England, GP surgeries immediately stopped seeing patients face to face as a routine and stopped allowing patients to book in face to face. And the reasons for that were, first of all, safety, because numbers were exponentially increasing in March last year, and doctor surgeries were kind of identified as a place where transmission could happen. understandably, if you've got people with coughs in the waiting room, you know, they risk spreading COVID. But also for the workforce, you didn't want people going off sick. So I understand why it happened, but I mean, I hate telephone consulting. I don't enjoy it at all. It takes much longer to consult someone on the phone than face to face, because as you know, Emmaline, as a doctor, you get so much from physically looking at someone.
Absolutely.
And also in your consultations, you get a lot from the way that they just talk to you, you know, their body language. You can pick things up from it's not just the words that they say, it's how they say it and how they present themselves, which you don't get on the phone. Now, not everyone needs to have a face-to-face consultation. There are some presentations where you can just manage them on the phone and say, well, actually, if it doesn't go away with this, you know, treatment I'm going to give you or the advice I'm going to give you, then you come back and I will see you face-to-face. That's appropriate for some things, but for a lot of patients, they do need to be seen face to face. And sometimes, and sometimes the therapy is the consultation itself, you know, and sometimes seeing someone face to face, even if they don't need to be examined, they need that face to face contact with a human being to know that they're being looked after, to know that they're being taken seriously. That is the intervention. And what we're seeing now certainly is people are presenting later in their illnesses in general practice. You know, we're seeing a lot of pathology, so genuine physical signs, whereas normally in general practice, most of the people you examine, there is a normal examination. Whereas now, previous, I would say 90% of my examinations were normal, whereas now I say 90% are abnormal.
Really? That's a massive shift.
It is a massive shift. And that really concerns me. That makes me feel that we're not seeing enough people face to face. So I don't enjoy it. I didn't realise how much I enjoyed having contact with people in a non-GMC reportable way, obviously, before all this happened. And it's really just removed all the joy out of the job, to be honest. Every day feels like a slog. And I mean, for me, like, that's where general practice really excels. It's about forming relationships with your patients and going on a journey with them. And that has just been taken away from us. So yeah, I don't think it's good for patients. I don't think it's good for doctors either. But according to the latest NHS England data, we are now seeing half of our patients face to face and half of our patients are being dealt with remotely, kind of across the country. And actually, I think that feels good to me. It feels like we're moving in the right direction.
That's good. Because I know there was a bit of worry that people were thinking after the pandemic, there would be a push, not from the GPs themselves, but maybe from more the management side of things to say, oh, look, we can do all this stuff remotely via phone. Isn't it easier? Let's keep doing it this way. And I remember there was a lot of chat about that. And that was a real fear because no doctor wants that at all.
No. But actually, it's interesting you say that, because in out of hours, they have said that they are sticking to the new system and they're never going back to the old system, which frustrates me, because what they're basing that on, we have been told, is the fact that complaints haven't gone up. And personally, I think that's a really reductive way to evaluate how good your service is.
Yeah.
It's not necessarily about how many complaints you're getting. It's also about patient satisfaction and doctor satisfaction. But I think perhaps in the out of hours situation, I mean, you know, a lot of it is acute and a lot of it is signposting. So you can do that sometimes on the phone a bit easier than when you're seeing kind of more routine stuff in your surgery. So I think there is an argument to keep that, but we are seeing more people in out of hours now, certainly, than we did at the start of the pandemic. So I think whether or not they'll be able to stick to that, I don't know.
Yeah, that's good. And in terms of people presenting, you know, with pathology, do you think, is it partly that because they haven't been able to be physically examined for this period of time, or do you think people have been avoiding, you know, seeing doctors or presenting, again, because of COVID? Because I personally have had people come into A&E quite late, and it's usually an older person who says, I'm so sorry, I didn't want to come in because I know you're so busy, but it got so bad that I had to, you know. And I always want to say, first of all, never apologize for coming into A&E and seeing a doctor if you're unwell. But I wish you'd come in sooner, you know, because people wait and allow things to progress.
Yeah, I think there are a few factors involved. I think there are patient factors. I think patients have been scared, firstly, to come to their GP, because there was a at the start of the pandemic, there was such a big deal made of the fact that GP surgeries weren't safe. I feel that was very much put across, and so I think people were scared to come in. I think there is certainly a cohort of patients who don't want to bother the GP because they know that the NHS is really under it at the moment. We're all under a lot of pressure. And then there is a group, then there are patients who have had contact with their GP. So if technically they've been consulted, but they haven't had the right type of consultation to pick up what's really going on. So I'll give you an example from when I worked in out of hours a couple of weeks ago. I saw a chap who had a consultation with his GP, 3 consultations in fact with his GP within the last 3 weeks, but they had all been phone consultations. And in between the consultations, he'd had some bloods, which were relatively normal. However, because it wasn't a face-to-face consultation, and because actually he wasn't the best historian, he wasn't able to put across what the real problem was. And it was only through seeing him face-to-face that I was able to do that. And I picked up quite a nasty pathology that then needs quite like urgent investigation. And his daughter came with him, and she was like, we're really worried about him. He just needs to be seen. And I was like, I absolutely agree. He does. You're right to be worried because he's actually quite sick. And again, I think it was just, he didn't want to bother the GP. And then when he did, it was quite a significant, I know, it's awful, isn't it?
Yeah.
It was quite, he's quite far into his illness. And technically he has been consulted, just not in the appropriate way to pick up the issue that he's got. So I think there are lots, several factors as to why people are presenting late.
It's a complicated situation.
Yeah. And I think sometimes patients do come to GPs with certain problems, but actually that consultation is the gateway to what the real issue is. So you don't get that on the phone because the patient has to trust you. Like you joke about it in GP, right? The patient will sit there and you'll have a 10-minute consultation with them, and then you'll say, okay, that's fine. I'll go off and have some bloods or whatever. I'll see you in a couple of weeks. And then they get their hand on the door, and then they'll go, oh, actually, doctor, there was another thing, and you're like, oh my god. But it's because they needed that initial few minutes with you to get confident to then really say what's going on, and patients don't do that on the phone.
No, absolutely. One of the other things I wanted to ask you about was your work with the DAUK, because they're a brilliant organization. Like I joined a few years ago now, I think maybe 2 or 3 years ago, but when COVID hit, that was when I really started just seeing all of the amazing work that they do. So could you tell us what the DAUK is and how you started to get involved with them?
Yeah, so Doctors Association UK, I think it was set up in 2018 as a result of the Hadiza Bawa-Garba case, because they supported her through her legal case. And what it's turned into is a lobbying group. And they basically were set up, I think, not just because of what happened to Hadiza, but also the fact they didn't feel that the organisations that represent doctors were really able to lobby effectively for what the majority of doctors really want.
Yeah, and I think a lot of us agree with that.
Yeah, absolutely. And so I guess it was, an alternative to the BMA, which I personally, no disrespect to, I'm a member of the BMA, by the way, but I don't feel that they are an effective union. I don't feel that they really campaign for what we need, and I suspect that's all to do with politics, and their hands are probably tied as to how responsive they can be and all that sort of stuff. But I became quite disillusioned with the BMA with the junior doctor strikes initially, and then with a lot of the fallout from that, I did actually initially leave them, and then when I became a salary GP I went back because I wanted the legal support, but I that was because I needed it, not because I wanted to go and join them again. So DAUK are kind of the voice of frontline doctors. They're very responsive and they're very vocal. And I really liked their ethos. I joined them at the end of last year, and then they were looking for GPs to join their newly formed GP committee. And, I was so fed up of being in situations where I felt like I was raising concerns and I was doing it appropriately, very similar to you actually, Emmaline, and management were not really acting on my concerns, the people higher up the food chain. And I didn't feel as a salary GP that I had a voice, that I could enact change. My agency was very, very limited. And so I was like, right, I really want to bring about change. This is not good enough. not happy. And it just so happened that as I joined DAUK, this opportunity came up. So I went for it, got the job. And now we are, the GP committee meet regularly, and there's lots of stuff that we're planning to do in terms of kind of lobbying for GP issues. But I am also part of the wider DAUK group. And we meet every week, and I think that we do some really good work.
Oh, absolutely. I mean, the DAUK just does amazing work. And what has it been like being involved in lobbying? Because I think a lot of this sort of, it's not stuff that as NHS doctors you usually would know how to do or how to go about it. How has that experience been? Or did you have any experience prior to this to being involved in anything like it?
No, not as a doctor. As a student, I was very politically active, but I think with medicine, it kind of gets beaten out of you. You're kind of taught to keep your head below the parapet. Is that the phrase? I don't know. And not to stick your neck out.
Yeah,
and if you do raise issues, quite often, I don't know if you found this, but you get fitness to practice gets thrown at you, and you feel like your career is potentially being threatened if you kind of raise issues, even if you're doing it appropriately. It feels like you are being judged, and it feels like you are putting your career at risk if you do that. So I'd kept my head down for quite a significant period of time. So no, I hadn't done any lobbying until I joined DAUK. What I would say about DAUK is it's very fast paced, so it's quite exhausting, but that's because they like to be responsive to the issues at hand. So we have a fast turnaround for things like press releases and campaigns. It's really interesting because I don't just get to see what the GP committee are doing, I get to see what the main committee is, what the main body is doing as well. So we've recently done NHS Overseas Workers Day, so we're pushing for it.
That was brilliant. I loved that.
So Pushpo was the main person behind that. We've got lots of celebrities behind us. We've now got 60 MPs behind us, lobbying for indefinite leave to remain for overseas workers on visas to remain in the UK. And what else are we doing? I can't remember now. But there's lots of stuff going on. But it's really fast paced and it's really exciting. I feel really enthused, and particularly when you see things like the Overseas NHS Workers Day resulting in 60 MPs saying, actually, we agree with your, what you want to achieve. That makes you feel really good because you can see that there's a process from setting up the lobbying or the event to change actually happening. So that it feels good. It feels really exciting, and it feels like I have an opportunity to make change, whereas in my previous jobs I never felt like that.
Which is amazing. It's very empowering. And we just had a question come in just asking, I think, what can juniors doctors do if they want to become part of the DAUK? So I think to become a member is quite straightforward, isn't it? You can just, if you just Google Doctors Association UK, you can go onto their page. You can get a sense of, everything that they're doing. If you are interested, you can join just by paying a membership fee, and they're very transparent with, what they do with all the fees. It all works towards, or all goes towards working to lobby for doctors. And there's a few active Facebook groups as well. So they run the consulting room. Yeah. And that, I love going through that because I feel like I keep very up to date on everything that's happening in the medical world. Yeah. And then a private Facebook group as well, just to keep members updated on what the DAUK is doing. And I think they're always looking for people, if you want to get involved in a more active way, there's always opportunity.
Yeah, just to add to that, it's £10 a month, but if you're a student, it's much less. I can't remember how much. I think it's like £1 a month or something like that. So it's not a huge amount of money. Mm-hmm. In the members Facebook group, we're doing like a live stream series, so we're getting people in to talk to the members regularly. We also run polls regularly, so we're responsive to what our members want. And the next thing to say about that is we are about to go on a membership recruitment drive and be recruiting people to the various committees as well. So I think, if I remember this correctly, I think the GP committee are going to be recruiting social media team, I think also, and then there's one other team which I can't remember off the top of my head, but applications will be opening very shortly. So if you're interested, if you want to get involved with an organisation that is having impact, then, join us and make an application if you're interested in actually getting involved with how the organisation works.
Yeah, and the DAUK is such a great organisation to be involved with. And even though I'm only a member, so I'm not actively sort of involved in anything else right now, but I'm, you know, so happy like to be able to contribute to the work that you all are doing, because I think you know, so many doctors are actually very grateful to have such a vocal, well, just to have a voice to articulate all of our concerns. And I think the DAUK do a really, really good job of doing that.
Thank you. And just to, the only other thing I would say to that is as well, it's for me, it's a voluntary role. So, you know, the money is used for for lobbying for projects for our members and our members' needs as well.
And so you do quite a few different things. So DAUK takes a lot of your time. Obviously, you're working as a GP.
Yeah.
I've mentioned the aesthetics as well. So you have a beautiful portfolio career. And actually, I think before I met you, it wasn't a term that I'd heard used before, portfolio career. And again, I think when we were chatting on the phone the other day, we were kind of saying in medical school, it's not an option that is ever presented to you as a medical student, that, you know, you can do things alongside whatever your NHS job is, or, you know, taking a break and go doing something else. It's not ever something that, you know, we're told about. So if you could define a portfolio career, how would you define it?
Yeah, so well, let's start with what a normal medical career is. So a normal medical career is you have one job. So for instance, you're a consultant, you're employed by your trust to do your job in your hospital, or you're a GP, so you're a GP partner, or you're a salaried GP, so you're employed by one employer. You go every day to work, you do your job, and then you come home. A portfolio career is just where you have more than one role. So that can work for a consultant, it can work for a GP. I would say that general practice is the specialty that lends itself most to portfolio working, because we tend to be sessional, and no one works full-time as a GP because it's just horrendous. And it is easier to do it less than full-time as well. If you're doing more than one role, it's hard to do it if you're working full-time. It is possible, but that's essentially what a portfolio career is. It's lots of, more than one job, basically.
And so I know one of your other, well, you have so many interests, but one of the other things that you're really passionate about is health inequalities. And when you first qualified, you did a fellowship and you did a degree in public health, is that right? Or a certificate?
Yes.
Tell us about that.
Yeah, so I knew during my GP training that I wanted a portfolio career, and I was kind of taking a few steps during my training to get to that. I wasn't actually going to take a salaried post, but I ended up taking it as part of my fellowship. So at the end of my training, a job was advertised in a local area for a health inequalities fellowship. And what it involved was working with a local educational hub that provides education for primary care workers, so not just GPs, but practice nurses, health visitors, school nurses, HCAs, anyone that works in the community. And it was going to have an inequalities focus, so tackling, kind of running and promoting educational programs to tackle health inequalities and working with the patient populations and surgeries in deprived areas. And then the other part of that job was they funded a postgraduate certificate in public health. So I went back to uni and I did that. I graduated in July, and
congratulations.
Thank you. It was fantastic. I loved it. It was weird going back to university being twice the age of the freshers. And having a moment of realization of going, oh God, I could actually be your mother. But I really enjoyed the course. So the course, I was at the University of West of England, and their public health masters is kind of internationally renowned. So half of the students were international graduates. So we had people from all over the world joining us. We had quite a lot of people from the Far East. We had people from Europe. We had quite a lot of people from various countries in Africa. So it was a really diverse intake of people, all bringing different experiences to the course and different qualifications as well. And it's a multidisciplinary course too. So it's not just doctors that do it, it's anyone, it's open to anyone who meets the criteria to join it. So the biggest thing that I did as part of my fellowship was myself and one of my colleagues organised a conference for community nurses. We held that in the November just before the pandemic, and we had 150 people come to this conference. So yeah, it was a really great experience to do that. I learned a lot of new skills, but it was only a year-long post, unfortunately. So there wasn't the funding after that year finished to continue. But that was like my first taste of portfolio working. So what I did was I did half the week in surgery, and then I had one session, so that's half a day a week doing my health inequalities work, and then a full day at uni. So I was working 4 days a week, but not all of that was doing my GP work.
Okay. And I think, you know, you said this to me before as well, that a lot of people aren't aware of these opportunities or these fellowships that exist. You know, they can be in very sort of specific or unique areas that are of interest to you, but sometimes you're not even, you know, aware that you could go off and do something like this, and you have to do a bit of searching around and hunting. But actually there's so many interesting fellowships that you can do. How did you find yours?
So I was emailed the job advert by the administrator of my VTS program. But you're right, it is difficult to find these opportunities sometimes. So my recommendation would be to talk to as many people as possible, because the more you talk, the more you network, the more likely people are to remember you and to think when they see something, they'll go, oh, I'll text Claire and I'll let her know. I know that she's interested in health inequalities. She might be interested in this. Get on various mailing lists, so hospital mailing lists, CCG mailing lists. If you're a GP, the Next Generation GP program is really helpful for networking and finding out about job opportunities. So they've just opened their books for their intake that's starting this autumn. You do have to apply for it, but they do events, and it's all about kind of building the next generation of GP leaders. But the people they get in are largely people who have portfolio or kind of careers slightly off the beaten track. So that's another way of finding out about stuff. If you're a GP, then sometimes the local LMC have got jobs on there. Look at the RCGP website, NHS jobs as well. Our local training hub. So if you work in a community, your local training hub or educational hub will also have job vacancies. At the moment, I know that in our area, we've recently had a frailty fellowship. We've also had a mentoring fellowship, which I thought looked really interesting, and I would have applied had I not been doing other stuff. I was like, oh no, I think I'm doing too much now.
And you mentor now as well, alongside everything else you do.
I do, yeah. So I've learned a lot during, you know, the past sort of couple of years. It's been a very steep learning curve. And I've done a coaching course. I've done a little course in mentoring as well. And so I do offer mentoring of other healthcare professionals, so that, you know, people who have career dilemmas or conundrums can come and, you know, talk things through and get a bit of advice. Because actually, when I burnt out, I really wish that I'd had someone to help guide me and work out what I needed to do, not to get better, because that needed to be done with, you know, kind of other professional support. But in terms of making my career work for me, it would have made the process a lot easier and probably a bit faster as well.
I think that's one of the reasons though why the platform that you've created with your page is so helpful. You know, and I've said this 1,000 times, but even for myself, you know, when I've been quite stressed working through the pandemic and everything, I have found your page really helpful. And even on a personal note, like, you've been so kind. So, you know, we send each other messages and voice notes sometimes if something has happened during the day. And, you know, it's just, I have really appreciated being able to chat with you about these things, because again, you know, when I went through my burnout a few years ago, I didn't talk about it at all, and I didn't ever really even admit it. I was just like, you know, I'd say, oh, I'm stressed and I'm sick of this, but in an almost like casual, offhand way, you know, whereas actually no, I really was stressed, and I was really sick of it, you know. So it is so helpful to have someone to speak to.
And it's been absolutely wonderful to connect to you on Instagram. I feel that that's what social media is about. It's about building meaningful connections in real life as well as online. So yeah, I'm thrilled to have been able to meet you through here. But just coming back to what you were saying about your burnout there, I felt exactly the same. I barely could acknowledge my burnout myself, let alone talk about it openly. I felt really ashamed. I
Yeah.
felt, what's wrong with me? Why aren't I able to deal with this? Why can't I cope with it when I'd sailed through the rest of my career? Apart from when I kind of wasn't sure about anesthetics, I wasn't too happy, but that wasn't medicine. That was just, it wasn't the right specialty for me. And there was absolutely no way I could have talked about it publicly at that time. Whereas now it has been a long recovery process, but I am in a position now where I feel like I can talk about it. And with COVID, I feel like there are a lot of people now in the position that I was in when I burnt out who were really struggling. And I know how lonely, how isolating, just how awful it feels. So if I'm able to help people through my social media platform, that makes me feel good. I want people to feel like they are part of a community, that they're not alone, and that it's okay to be experiencing those feelings, and that other people have been through the same. And I think it's really important that we break down those barriers.
I think there's a massive tendency to, on the surface, just act like everything's okay and everyone does it. And I remember what I found, in my first year as an SHO, if I started to become really good friends with someone and was able to sort of scratch the surface, then immediately, like, the first thing I found is they were feeling the way I was feeling. There was a lot more burnout going on than I realized, which is no one really showed it. And I also think we have a really, really bad tendency in medicine to glamorize overworking, or, oh, I've done 7 nights in a row and I picked up an extra shift, and oh, I'm so exhausted. But it's almost like, I don't know if bragging's the right word, but it's almost like we put this, like, the ability to do that up as if it's something really, really good, when it's like, no, it's bad. That is unhealthy, and no one should ever be put in a position where they are forced or made like they to feel like they have to work like that.
Yeah, I think there is a toxic culture within medicine, and I think we need to start addressing that. And it's difficult, isn't it? I think as a group of people, we are, generally speaking, very high achievers, and we're givers as well. So we want to prove to ourselves, we want to prove to our colleagues that we can do the job and that we can do it well. And I think, unfortunately, what that means, therefore, is it's hard to admit when you're not doing well.
Yeah.
And I think that we do have fear of failure too, and because the mechanisms are not in place to support us when things go wrong, we keep it to ourselves. And the other thing is, I do think there is still a stigma within medicine of admitting that you have a mental health problem. I really think that we don't support doctors that say, I've got anxiety, or I've got depression. I think I think there is still that stigma. Even for physical health problems, I think actually we do that. There is this expectation that you're the healer, you shouldn't be suffering with any problems. But actually we do. That's what makes us human. And in dealing with those things, I actually think it does make us better doctors. I think the people that deny it are probably the ones that are working in bad ways and are more likely to make mistakes, actually.
Yeah, I agree. And there was something that you wrote about self-care that I really, really loved, where you were saying, people think self-care is all about, oh, I'll do some yoga and exercise, and eat well. And of course, that's part of it. But then you were saying there are other aspects of self-care that are much more important that people forget about, like, boundary setting, being able to say no. And, like, I know my first year as a doctor, I did not know how to say no or set boundaries. I allowed myself to be bullied by everyone left, right, and center into, doing things that I shouldn't have never have been asked to do. And I didn't know how to, say, actually, that's not an appropriate request, or, you know what, it's 7:00, I'm going home now. And I learned actually quite quickly, but not in a nice way, but I learned quite quickly that I did need to do that.
Mm-hmm. Yeah.
And I think once I was able to start doing that, that actually improved things for me. But it was actually really, really difficult to change that mindset, because and I think for a lot of people, your automatic instinct is like, yes, of course I'll help out. Oh, if they're asking me to do this or telling me I have to do this, then they must be right. And boundary setting, it's such a difficult thing to do.
Yeah. And I think by nature, medics tend to be people pleasers as well. So we want to please our patients, we want to please our colleagues, but quite often at the expense of our own mental health. And I think it's about learning to say no in a way that feels comfortable for you and allows you to work productively. And actually, it will make, I have learned the hard way to be boundaried at work now. I am now very boundaried because of my burnout, because I know if I'm not, I'll end up there again. And I'm just very honest about it now. If I feel like I'm getting overwhelmed, I will go and say to someone, whatever it is. Like when I was doing my salary job, if I was getting too many patient, appointment requests, I'd send a message to the person that was allocating me the appointment request, and I'd say, I can't take any more, I'm afraid, unless it's urgent. And they'd immediately respond and say, that's fine, we'll stop sending you them. But whereas before, I would have just allowed that to continue to happen and just got more and more stressed about it. And the other thing that is helpful when saying no, because we are very bad at saying no, is providing an alternative solution, I think. So you're not just saying no and leaving it at that, but you are allowing that person to find alternative ways of getting around it. So saying, well, I'm really sorry, at this point in time, I don't feel like I have the capacity to take that on, but why don't you speak to so-and-so? I know that they're free at the moment. Or why don't, if it's an audit, for instance, well, at the moment, I've got some annual leave coming up. I don't feel like I've got the time to commit to it, but perhaps after my holiday, we could sit down and go through it then when I've got a bit more time, or whatever it is. If you're offering a solution, I think that sometimes makes us feel a bit better about being boundaried and saying no.
Oh, that's a really good tip. I like that. That's a good idea.
Yeah.
Did you ever have a situation where someone really was trying to push past your boundaries, or push you into doing either extra work or work that you didn't think was appropriate?
I mean, it's just something that's insidious and it's always there, isn't it?
Yeah.
But I would say when it became out of control was in the first GP job that I took. Because the expectation was that we were all in it together and we were all there from 8 o'clock at night until whenever the work was finished, which was never before 8 o'clock. And that was the moment for me where I was like, I can't work like this, it's too much. Having kind of uncapped patient numbers, that for me was a real moment of going, it wasn't safe and it wasn't sustainable either.
Yeah. It's such a hard thing to do, though, I think, for some people. And I know for myself, it was just recognizing that and telling myself it was okay to put that, wall up and say, no, actually, I'm not going to do this anymore.
And actually, when the job that I've just left, when I took it, I was very honest and open with them about the fact that I did not want to be staying late. And I told them when I was negotiating the terms of the contract that I would be leaving at a certain time, and I would not be staying later than that. And I said to them, if this is a deal breaker, then I can't take this job because I'm not the right doctor for you. I would never have had the strength to do that before the burnout happened, because I know that for me, leaving on time, sometimes if there's a clinical emergency, then you have to stay, and that's fine. But I didn't want the expectation from the start to be that I would stay late. And actually, there were various reasons why I left that job, but that particular thing was not the reason why I left, because I was able to stick with that. And everyone knew from the start. I mean, they did try to push it at the start, and I sent a few stopping emails and went and spoke to a few people and said, this is the terms of the contract and I'm going to be sticking to it. But I would never have had the strength to do that previously. So I think sometimes it does come with experience and age. Yeah. Dare I say it? Because as an F1, you don't feel like you've got that power to do it, do you? Whereas now I'm, a few years down the line, I do feel like I have that facility to do that. And perhaps only with experience it comes.
Yeah. I mean, I even, in one of my more recent jobs, I was chatting with my parents about it, and sort of, a little bit of a vent saying, oh, they were trying to push this on me and trying to make me do this. And I just absolutely not. And they were both like, you've really changed. you really, really changed. You are so much firmer now. And I was like, oh, I think it's because I learned the hard way that I had to be.
Yeah.
that if if you're too nice or accommodating, a lot of times you get taken advantage of, which is such a shame, but you do learn really quickly.
Yeah. And yeah, you're right. And it is a shame that we have to go through that process, and that's what the system makes us do, you know.
Yeah.
But like you said, like once you've gone through burnout and it's affected you to that extent, like you know that you just have to look after yourself. And it's not about the fact that we're not prepared to work hard, or we're not prepared,
No.
we're not team players. It's not about that. It's about working in a way that is healthy.
Yeah, because everyone works hard. Everyone's a team player. I think,
Mm.
in general, everyone within this profession always wants to, do their best for the patient. And no one goes into medicine thinking, oh, this will be a nice, cushy job. It'll be easy. I won't have to ever work late.
Mm.
Like, no one, has that mentality.
Mm.
But it's just, you can't be constantly pushed and pushed and pushed.
Yes, absolutely. Agree with that.
But I feel like I could just talk to you for ages and ages and ages. I wanted to ask you about aesthetics, because
Yes.
that's how I initially first met you, was sort of via, our mutual interest in aesthetic medicine. I don't think I've ever asked you, though, how you got into aesthetics or what led you into aesthetics.
Yeah. So it was something that I considered. Like I said before, I knew when I was a GP trainee that I wanted to do some portfolio working, and aesthetics was something I considered, but I didn't go down that route because I felt like it was a lot of money to spend and it looked like a lot of hard work, and I wasn't sure that it was quite right for me at that point in time. And then I'll tell you how you'll laugh at this actually. I was at my local beauty salon with my waxer, and I was telling her about how, my job and some of the difficulties I'm having with it. And she was like, well, have you thought about doing some Botox? And I was like, yes, I have, but I wasn't sure that it was right for me. She was like, well, have a chat with the manager. I'm sure she'll be happy to have you. And then I was like, oh, well, if it's going to be that easy, then maybe I should consider it. And I went off and I did a bit of research. I talked to Amber Woodcock, who's a cosmetics doctor who I'd met through Instagram. I don't know if you follow her, if you're aware of her. She's a medical registrar in Norwich, and she gave me some really good advice. I went away and researched kind of the different training courses and how people work. And I've always, I think, yeah, I think what I get out of aesthetics is what the NHS doesn't give me in my clinical medicine. So I get to run the show. I get to decide how long I spend with my patients. I get to decide what I do to my patients, obviously in negotiation with them. By and large, I make them really happy, which I never get to do in my GP job. And I get to build relationships with them because people come back. And it's actually really satisfying in that respect. It gives me a lot of the satisfaction that was missing from my NHS work. So I was really pleased to have found that I enjoyed it as much as I did. It's also taught me lots of new skills. So not just like in terms of practical skills and knowledge, but things like business skills and using your social media to build a business, and budgeting and working out profit margins and all these things that I had no concept of before I started that. It's been a massive steep learning curve, but it's given me so much, like a new project. I love having projects. I love learning new things. I think all doctors do. And I love learning new skills. So it's a kind of a really good mix of practical skills, patient interactions, building a business, and being your own boss. I really enjoy being my own boss. Yeah, and I don't know how you got into aesthetics, but that's my story.
And I've heard something similar from so many people about, happy patients. I mean, most of the patients that I see, there's no reason why they should be happy because they're very sick or they're in pain. But most of the time when you see patients, it can be quite a difficult experience, for them and for you. But it is a little breath of fresh air to have patients that, you're just doing something really lovely. You're helping with their self-confidence, that they walk out, feeling amazing after you've seen them in clinic. Like it is very different from a lot of what happens in the NHS. So it's lovely to have that sort of balance to what you do. And again, like you said, being your own boss or just having a bit more control over things, being able to say no to a patient, or, you know,
Yeah.
if you're getting the vibe like, I'm not going to be the right clinician for you, to be able to, you know, say, actually, someone else might be better suited to what you want. But it's nice to have that control over what you're doing.
Yeah, definitely. I feel exactly the same. I think one of the things, I think why originally I dismissed it actually, and this is going to highlight some of my own personal prejudices, was I felt that perhaps people who went into aesthetics were a bit greedy. This is not the truth, but that was one of the things that put me off. And I now realise that was the wrong thing to think, because actually it's really hard to become established in aesthetics. And yes, there is money to be made, but to get to that point requires an awful lot of hard work, commitment, dedication. And I, yeah, I think I had to kind of come to terms with that. You know, it initially felt uncomfortable to be going out and making money doing something to a patient, because we're not used to money exchanging hands.
No, not at all.
And I think once I became comfortable with that, that was the moment, plus the chance encounter I had with my beauty salon, that was the moment where I thought, well, actually, maybe I could make it work. But yeah, for all the reasons you said, that's what makes it a really rewarding area of medicine to go into, I would say.
Yeah. And you're right, it isn't the instant money maker that people think it is. I mean, you invest a lot of time in training, and like you said, building yourself up. It does require quite a massive investment. And I think it, you know, for most clinics, it takes a couple of years before they even start seeing any profit whatsoever. So it's not something you go into to try make money. I don't think you have to actually genuinely, really, really like it and love it.
Yeah. And the industry does come with problems. And so if you if you're and you know, it's a wonderful, in some respects the people that are in it are amazing, but it is an industry that does have problems, and so you have to love it, you have to enjoy it to be able to make it work. Otherwise, you know, you're not going to last very long, unfortunately.
And I don't know if it's worth like going into, you know, all the regulation, the lack of regulation, everything. But for me, like coming from the States where, you know, this field of medicine, it was pretty much within the remit of like a plastic surgeon or a dermatologist, right? And it certainly wasn't even a possibility that legally, you know, anyone else could inject your face. So coming to the UK, in a way, it is, you know, it's frustrating, it's a difficult situation, the lack of regulation from, you know, a patient safety point of view. And I also think, you know, for a long time, this isn't a medical specialty that's been particularly respected even amongst other medical professionals, which again is such a shame, because it is quite a skilled specialty, and again it does take a lot of work and dedication to get good at it.
I think there is even you know, you're right, like it does take a long time to become proficient and really good at the job, and I think there's almost an argument really to make it a specialty of its own, with its own specialty training. Personally, like I think it should be part of plastic surgery or the surgery pathway, because there is so much to learn, and there are so many different techniques to learn. It could take, you know, a few years to properly train up and to become like a master practitioner, if you want to use that kind of phrase. But,
and I think the BCAM, they are trying to move in that direction. Like I think they would like to try to become one of the royal, you know, colleges, like Royal College of Surgeons, etc. But I just don't know. It's just so unclear what's going to happen in the future with regulation and the training pathways.
Yeah, definitely. I mean, we could talk for, I think, you know, you could talk for hours about the lack of regulation in the aesthetics industry, and what the failings are, I think, in that respect, the patient safety failings are. So but I for me, like, the advantages of the industry definitely outweigh the disadvantages, and I really enjoy spending time with my patients. Obviously not at the moment, but
soon, hopefully.
I know. And it's, I don't know about what you offer, but I don't just offer injectables. I also offer medical grade skincare treatments and medical grade skincare, and microneedling as well. So it's really lovely to be able to offer like a breadth of services, not just injectables as well, because I think people think that it's just injectables, but actually it's not. There's a lot more to medical aesthetics than that.
Yeah, and I actually love the medical grade skincare side of things. And what I really liked about it is when I first started, getting really into it and researching it and trying to wrap my head around it, I was finding I was really using my biology degree, because to go through like that research and all the papers, there's a lot of cell biology and biochemistry in it. And I was just thinking, you know what, this is actually really, really interesting. And there's a lot of pure science that goes into this that actually at my, if I'm in A&E, that those aren't the skills that I tend to be using there. And it was really nice to get back to basics in a way with biology and just sort of pure science. But yeah, I love it.
Yeah, I definitely resonate with that. And I've actually been really impressed with the quality of training when it comes to the skincare stuff. I feel like I've learned more about dermatology, well, cosmetic dermatology, I guess, than I did in my 3 weeks of dermatology at medical school, or however little we got given. So I feel like I've learned an awful lot in a very short space of time, and I still feel like there's a lot more to learn as well. But I'll just suck it all up. I love learning. I love science. I can't get enough of it, and aesthetics is definitely an area of medicine that feeds that kind of that need to learn continually and
definitely
new stuff.
And because I think so much of it as well, it's self-directed, and it has to be like you have to go out and actively seek out the learning and the research, make sure you're well trained, because no one will hand it to you, and there's not a nice set pathway where they lay everything out and say, oh, these are all the things you need to do. Like, you do have to be really active in looking for again, opportunities to train and learn, and just seeking out all the knowledge.
Yeah, definitely. I mean, I don't know about you, but I've got, I had loads of training plans last year. Unfortunately, none of it happened. So yeah, I'm looking forward to kind of picking where I'm going to go next with the business and with my skills as well. It's exciting.
It is. And things are looking, hopefully things are looking up for the spring and summer.
Yeah, I hope so. I really, really hope so. But as with, I think what the last year has taught me is that we can't kind of assume that things will be straightforward. So I'm not getting too hung up. I haven't booked any training yet. I've not, I've still got stuff to reschedule from last year. So I'm just going to take it as it comes. And I think this year is just going to be about rebuilding and getting my established patients back and feeling happy with my skill set. And then hopefully from next year, I can start kind of doing more training and growing.
Yeah, I agree. I've just told myself I just need to be relaxed about it, and not, because this year's not been great for anyone.
No. But what I would say is that one of the advantages actually of having a portfolio career, therefore, is that because you've got multiple streams of income, if one is taken away from you, like for instance aesthetics, I've been closed. How many months have we been closed in the past year? I think I was only open for 4 months last year. Is that about right? It's like September,
I think so. Yeah, 3 or 4 months.
Yes. If you've got more than one job, that if one job is not working for you at that point in time, that you've still got other sources of income, you've still got money coming in. So I was very grateful when, my phone's
that's all right.
just shouting at me. I was very grateful actually that I had other things that I could pick up to make up for the shortfall in income from the aesthetics being closed.
Yeah, I agree. That is the beauty of a portfolio career.
Absolutely.
So look, I've kept you so long. It's been over an hour. But I've loved being able to chat with you. I actually I won't show you. I have this list of all these questions I wanted to ask you. I think I've gone through not even half of them, but
wow.
My phone's shouting at me now too.
Nice comment.
So someone said, I can't express how grateful I am to you both for having this conversation out loud. I'm so glad it's been helpful. And again, I think as we were both saying, people don't talk about burnout. They don't talk about, everything. Sorry, I'm speaking and trying to read comments at the same time. But you know, I think it is helpful to have these conversations out in the open. And, you know, you're not going to recover from burnout or from any sort of stress or mental health issue if you're not, you know, if you don't talk about it, or even just admit it to yourself that you're going through it. And that was one of the things I struggled with, is I just was in complete denial that there was anything wrong, even though actually, if I was just looking at everything I was going through, I was like, well, this is not your normal behavior, you know, the going to bed, the being so tired all the time, starting to get really apathetic. But I'm glad that these conversations have been helpful.
Yeah, and I, you know, regardless of where my portfolio is going to take me in the future, I will continue to talk about this, because I think that the conversations need to be had. And we need to fight for better support of doctors. We need to change our working cultures and our working practices to ensure that we can work sustainably and be happy and fulfilled. And, you know, if we don't do that, people will leave the profession, and it will make it even worse for the people that are left, and it'll be terrible for patients. So everyone wins in having these conversations, I think, and in
Exactly.
So I'm going to continue to talk about it regardless of where my career goes. I don't feel like I answer to anyone. I don't, you know, I will have a career regardless. So I don't care who I piss off. And I will continue to push that. And I hope that if it makes other people's lives easier, if it brings, you know, if it makes people feel like they're part of a community, and that, you know, that they're not the only ones, then my job is done, basically.
Yeah, because there are too many brilliant, amazing people who have been chased out of medicine.
Yeah.
No, because
I was very nearly one of them.
Yeah.
I wanted to leave, and in fact, if I didn't have a mortgage or children, I probably would have done. But I didn't. I'm glad that I didn't.
I'm glad that you didn't.
Yeah.
Your patients are glad that you didn't.
I mean, I love medicine, like genuinely love it. So I'm glad that I'm still here. I would be lying if I said that I didn't have those thoughts. But it's about making the job work for me now, as I'm sure it is for you as well.
Yeah, definitely. Thank you again so much for giving me so much of your time. And tomorrow, I know you are going to do another live with Dr. Joyce, who is signed Dr. J on Instagram, and she is amazing as well. So I'm going to be tuning into that. I'm looking forward to hearing more from you tomorrow night.
Yeah, I think it's going to be, so we're going to be talking about, the title is How Are You Doing Really? So it's going to be a focus on mental health. Obviously I'll be talking about the burnout again, but perhaps more about what I did to get myself better and how I'm kind of sustaining my mental health going forward as well. And I think Dr. Joyce is going to be kind of chipping in as well with some of her experiences. So yeah, I think it's going to be a really good live. We'd love to see you there. And yeah, any of the guys that are watching today, if you're interested, it's signed Dr. J.
Perfect. Well, I will be there tomorrow.
Fab, I'm looking forward to seeing you there.
All right. Enjoy the rest of your night.
Thank you.
I'm sorry I've kept you so late. I'm so bad at the time. I always tell myself like 45 minutes max, and then I'm always way over.
Well, thank you so much for having me. And I could have talked all evening. But yeah, it's been great. Thank you.